Simon Clarke is a cellular microbiologist at the University of Reading. He joins me now live. Thank you for joining me on the program. You know, we've heard repeatedly from health experts that the best way to protect yourself is by washing your hands, staying home when you're sick, covering your mouth and nose when you cough and sneeze. It seems really simple, but why is hand washing so effective?
Why? Well, obviously, when you go out and about and you touch hand railings or door handles and things, you can pick things up. But the reason why, essentially, is because when you cough and you sneeze, you put your hand over your mouth or your face, and that will inoculate your hand with virus particles, which you can either then spread to somebody else, either directly by touching them or by putting them onto things like door handles or hand railings, things like that.
So before this COVID-19, there was SARS and there was MERS, other coronaviruses. Why don't we have a treatment for coronavirus? And with the vaccine possibly 18 months away, do you think that's going to come too late?
For this, probably yes. We'll probably have if it's going to establish itself as endemic within the population, the human population, it will have probably happened by before the 18 months that you mentioned there is up. I mean, it needs to be remembered that there are also 4 circulating endemic coronaviruses in the human population that cause the common cold. And you can get those, and you do get those again and again and again. You and I have probably had most, if not all of those. So there is no protective immunity. It's not like, for example, measles, where you get a protective immunity after you've had the first infection. Your immune system doesn't react in that way to prevent subsequent infection.
Mm-hmm. So why is it hard to get a handle on this virus? Despite all these extreme quarantine measures that we've seen in China, we saw the cruise ship in Japan where people were quarantined there for weeks, and yet more and more people kept getting the virus, and now we're seeing it spread around the world. Why is it so hard to catch this and stop it?
Well, it seems to be a very fit, if you like, very able virus that can move between people very easily. And that's what evolutionarily is advantageous to any infection, is to be able to move from host to host with ease, and preferably without damaging the host. And that's what we see here. We see people, the hosts, the host organism, being infected, and some people seemingly not getting any symptoms and spreading it on to somebody else. So the virus gets to replicate and spread and make more copies of itself.
We've seen a second death in Washington state in the United States, and officials there are saying that it's possible that the virus was spreading in the community for weeks without people realizing it. And you mentioned that in some cases the symptoms are very mild, and I've seen people who had it, who recovered, saying, oh, actually it felt less terrible than the common cold. So do you think we're seeing it spread unchecked in many areas because people just don't realize that what they're getting is the coronavirus?
Quite possibly, yeah. I mean, it's now March, but through January and February, people expect to get colds. It's not unusual, particularly not in the United Kingdom. It's very usual, in fact. So, yeah, people just put it down, in many cases, I suspect, to having a cold.
Mm-hmm. So what's the lesson that we can learn here? Can we expect more viruses like this to pop up down the road? And what can health officials and governments do to be better prepared?
Well, viruses have always popped up and infected the human population. Our modern lifestyles, our frequent, easy travel make it much easier for a virus to spread. They will continue to evolve, and every so often one of concern will pop up and infect the human population. But it's always worth remembering that every year we get a bout of flu, and we get a new set of flu viruses which infect the human population and spread across the world. So we see it every year. It's entirely normal.
Okay, and then on that note, we'll leave it there. Simon Clarke, thank you so much.